This video demonstration on cranial nerve examination is designed specifically for medical students. Learn the systematic approach to assess all 12 cranial nerves. This video will cover essential techniques and clinical tips to help you accurately evaluate sensory and motor functions and identify abnormalities. You will learn how to perform tests like the visual acuity test, pupillary reflexes, and facial muscle assessments. In the end, some tips for a quick examination will be shared. By the end of this demonstration, you will be equipped with the knowledge and skills to confidently conduct a thorough cranial nerve examination, an essential component of the neurological assessment.
अस्सलामुअलैकुम, क्या हाल है?
ठीक है नाम
नाम क्या है?
सरफराज।
सरफराज, थोड़ा सा मुआयना करना है आपका, इजाज़त है?
जी जान।
इसमें हम कोशिश करेंगे कि तुम्हें कोई तकलीफ वगैरह ना हो।
First of all, we check for the olfactory nerve, ask about the patency, that the nose is patent, and
नाक तो बंद नहीं है कहीं?
नहीं।
so you can
इस
ask
तरह से हाथ नाक को
patient
बंद
to
कर लो।
just blow or inhale through each nostril one by one,
ठीक आ रहा है।
then use some
अगर आती है सही
pleasant perfume, close one nostril
अच्छा,
and ask the patient to smell it and describe whether he
अच्छी है, बुरी है?
can smell or not from each nostril individually.
ठीक है, चलो। ठीक,
The second nerve, the optic nerve,
अच्छा।
the first thing is
वो
checking
सामने
for
देखो,
the visual
कितना
acuity.
कपड़े गिनती पढ़ लेते?
Ask the patient to read some
वो क्या लिखा हुआ?
banner or board in the ward, or
दो लिखा
you
हुआ
may
है। और वो किस रंग के बोर्ड पे लिखा हुआ?
use any written text at some distance.
अच्छा, और अगर ये वाला रंग कौन सा है?
Normally you use Ishihara charts for this color vision, but you can ask patient to differentiate between red, green and blue colors to check for the color vision.
देखो ऐसे जरा।
The next thing you check is the field of vision, and field of vision is checked one by one in each eye and then together with confrontation methods. So ask your patient to cover the eye with one hand and using your finger bringing it from each quadrant of the field of vision from up to down till the patient tells that he can see their moving fingers. Do it on the other eye, covering your eye as well as your patient's eye, and then checking for
मेरी आंख में देखना है।
the field of vision. The detailed field of vision can be checked by using perimeter in the ophthalmology department.
ठीक है।
You can simultaneously check
खुली रखो, ठीक है?
the
बिल्कुल सीधा
lateral,
देखना है और देखो,
inferior and superior
नजर आई?
and
ठीक है?
oblique field of vision.
ठीक है। चल, ठीक, चल।
Next, to check the light reflex by showing light into the eye, bring the light from the one side and notice the pupillary reaction. This checks the both second as well as the third nerve. The second nerve is the efferent limb, which takes the signal from the fundus to the cortex, and then the third nerve makes the pupil constrict.
अब देखो जरा।
You can also notice the response of the eye to the accommodation or pupil response to the accommodation. Usually it is abbreviated as parla, or pupils are equal and reacting to both light and accommodation. Checking for the corneal and conjunctival reflex, ask the patient to look to a side and touch the white or scleral part of the conjunctiva and bring the wisp from a side and directly touching on the cornea. You notice that the patient would have a blinking as in response to, if they, again this is the efferent limb is through the fifth nerve and its efferent limb is through the seventh nerve. So an intact corneal conjunctival reflex would mean intact both the fifth as well as seventh nerve.
कितनी होगी?
Next, you check for the field of this extraocular movements of the muscles.
आपने उसके साथ साथ देखना है ठीक है
Right.
अगर
So
किसी जगह पे
you
आपको
first
लगे कि
ensure that the
उंगलियां नजर आ
patient
रही
can
हैं, दो
see
नजर आ रही हैं,
first,
तो
and you
ठीक है
demonstrate that
देखो ठीक है
he
ये भी तो देखो
does not have to
साथ
move
साथ
his head and just follow
ठीक
the eye in each direction where you move it. So you start from the center, move it to the extreme, extreme to the right, then up, and then down, then to the opposite side. You move it in oblique fashion, and then bring it down.
और इस जगह पे एक जगह पे देखते रहो पूरी इस तरह थोड़ी देर के लिए
Now, this is checking for the abduction of the eye, left eye, and adduction of the right eye.
देखते रहो ठीक चल
Notice the symmetry of the forehead and the eye, and
जोर से बंद करें
check for the frowning over the forehead. Now, this is the
अंगूठे की तरफ देखो
function of the seventh cranial nerve. Asking the patient to
ठीक है
show the teeth. Again, the facial asymmetry or deviation of angle of mouth to one side is noted. Asking your patient to
जोर से
blow or to have, say,
ठीक है
then the patient is asked to protrude the tongue and notice any deviation to any side or any lack of strength while the patient touches
जुबान के
his
साथ
cheek
इधर जैसे मेरे हाथ
from within the mouth
ऐसे
with his tongue.
ठीक है ठीक है मुंह खोलें आ करें ठीक है
Using your torch, you notice not only the uvula, its central place, it should be central, and when the patient asked to say ah, the soft palate would elevate. So notice the symmetry, notice the elevation. By touching the pharynx, this is checking for the gag reflex, which is the function of the glossopharyngeal nerve.
ठीक से
You ask about the taste, or you can check the taste over the tongue and over the distant.
दोबारा ठीक
Checking the hearing acuity. Again, you close
अब
one of the ear, and then either you use wristwatch and with it, which makes some tick tick sound, or you can just checking the sensation of the over the face, which is the sensory part of the trigeminal or fifth cranial nerve.
ठीक है
Using some sharp object to check for the pain sensation over the forehead, over the face, over the maxillary region, maxillary division, and over though down over the mandibular division. This jaw movement, the extension and as well as lateral movement, the function of the pterygoid is checking the motor component of the fifth cranial nerve or the mandibular division.
ऐसे ठीक है इसको जब देखो देखो ठीक ठीक चल
Ask the patient to shrug his shoulder, and this would be checking the accessory nerve. So this way we check the all cranial nerve one by one. When short of time, you can abbreviate your clinical examination of the cranial nerves, just paying attention to three components, looking at the eyes or examining the eyes in detail for neurological abnormalities, uh, examining the face for asymmetry, and then the examining the mouth would make things easier. So when you look at your patient face and you notice any ptosis or unilateral ptosis would mean a third nerve paralysis of that very side, and that paralysis can be just with the pupillary involvement or without pupillary involvement. So ptosis would mean ipsilateral third nerve palsy. Next, you notice the pupil. Now, the pupillary responses are noticed for equality. The pupils should be equal on two sides, for their size, constricted or dilated, or constricted bilaterally or dilated unilaterally or bilaterally would mean a constriction would mean uh, Horner syndrome, and dilatation would mean a third nerve paralysis. And then you also notice the pupillary response to light and pupillary response to accommodation. Together, put together, they said pupillary responses are equal and people are equal and reacting to light and accommodation. So this would cover that you have checked for the pupillary size, equality, and their response to light and accommodation. And this indirectly covers the second nerve and also check the third nerve because the pupillary reflex arc is through efferent to the second nerve or optic nerve and efferent to the third nerve. Now, checking for the corneal and conjunctival reflex again would mean that afferent limb is through the fifth trigeminal nerve and the afferent is through the seventh cranial nerve. Checking for the extraocular movement checks for the third, fourth, and sixth nerve, and you also notice nystagmus while examining the abduction of eyes. And these third, fourth, sixth nerves are checked collectively for there any paralysis or paresis of any movement in one plane. You check for the visual acuity, you check for the visual field, and finally you check for the fundus using an ophthalmoscope, and that would give you an information about any presence or absence of papilledema or raised intracranial pressure. When examining the face, the simple commands like asking the patient to look up and noticing the equality of frowning over the foreheads would tell you about the function of the facial nerve. An ipsilateral absence of frowning on the one side would mean that the lower motor type of paralysis of that very side. You ask your patient to forcefully skew the eyes or close the eyes, and you try to mm, open them with your thumbs, and l- lack of power or the difficulty in, say, keeping the eyes closed forcefully would mean again ipsilateral seven braces. You ask the patient to show teeth, and if your angle of mouth of your patients deviate to one side, that would mean that the opposite side, which is not moving, is paretic. And when you check the touch and pinprick sensation of the facial area, that would be checking for the fifth cranial nerve or trigeminal nerve. When checking the mouth, you ask your patient to open the mouth and forcefully resist by putting your hand under the chin, and this would be checking for the uh, mandibular division of the fifth cranial nerve, and the side to sideward movement, lack of power on movement to the one side would mean ipsilateral mandibular division weakness. You ask your patient to protrude the tongue forward and notice the tip of the tongue remaining in the center would be an intact hypoglossal nerve on the two sides. But if it deviates to one side, that would mean that the ipsilateral hypoglossal or 12th cranial nerve is paretic on that side. You ask the patient to say ah, and when he says ah, using your torch, you notice the palate, its movement, whether the uvula is in center and the palate moves up or not, and if it is not moving up in one part or one side, that side vagus nerve is involved. You ask the patient to open the mouth, close the eyes, and with the probe or a tongue depressor, you touch the posterior pharyngeal wall, and if the patient gags or chokes, that would mean an intact afferent and efferent component of the glossopharyngeal nerve. And finally, you check for the taste over the uh, tongue by using some electrode or using different uh, say substances like salt or sweet substance.
In conclusion, mastering the cranial nerve examination is crucial for any medical student aiming to excel in clinical practice. Remember, the accuracy of your findings heavily relies on using the correct examination techniques. Always approach each nerve assessment methodically, ensuring you follow the standardized procedures demonstrated in this video. Pay close attention to detail, as subtle abnormalities can be significant. Regular practice and adherence to these techniques will enhance your diagnostic skills and confidence. Thank you for watching, and keep refining your clinical examination.